Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Good morning, I'm Dr. Kerry Gelb, and welcome to Wellness 1280 on Open Your Eyes Radio. Please listen as I discuss the newest information in the world of health, nutrition, and sports every Saturday morning, 6 a.m. Central Time on AM 1280, The Patriot. Also, please share your thoughts by emailing me at drkerrygelb@gmail.com. That's drkerrygelb@gmail.com, and visit my new website, wellness1280.com. That's wellness1280.com, where we have all the guest links, Wellness 1280 info, and previous shows. Wellness is taking over the Patriot Airways for the next hour. Sit back and enjoy part 2 of my conversation with Dr. Heather Sandison. We talked in part 1 about a lot of different things about Alzheimer's and dementia. So please go back to part 1 and listen to that. We will probably talk about mostly new things in this part. We may review some of the things we talked about in the first one. I do want to mention that Dr. Sandison is a naturopathic physician from California. Dr. Sandison's research, along with other research, has shown cognitive decline that can improve cognition. She uses diet, lifestyle, supplements, and many other factors because losing your memory problems is not a simple one thing could fix it. One drug is going to fix it. It needs a multimodal approach to be able to help people that are starting to lose their memory. Dr. Sandison, thank you for joining me again today on Wellness 1280, Open Your Eyes Radio.
Thank you for having me.
And last time we ended our conversation and we were talking about risk factors that were in a very famous journal, Lancet, a British journal. And Lancet said that if people were able to reverse these risk factors, they could decrease their risk of getting dementia or Alzheimer's by about 40%. And you mentioned that you, using your approach and Dr. Bredeson's approach, using 36 to 38 different types of things that have to be done, but really mostly staying healthy and being healthy, we could maybe get that up to 80%, getting rid of Alzheimer's. I guess the first Alzheimer's case was by Dr. Alzheimer. I guess he was the one that discovered it. I think it was in like 1906. Was there even Alzheimer's before our diet got so bad in the 1800s? And did the disease get much worse, dementia start happening because of the new standard American diet?
Yeah, these are such great questions. So, right, the Lancet Commission report suggested that 40% of worldwide dementias could be prevented. This is a huge burden on the society, right, to have people have dementia. Now, why is this happening? It's such a great question. Has it ever existed before? There's a phenomenal book called How Not to Study a Disease, The Story of Alzheimer's, by a researcher deep in the Alzheimer's space named Carl Harroup. And it's really a fascinating scientific journalism around what went wrong. How did we get this story so wrong? Why have we spent billions and billions of dollars and decades of smart people's time only to come up empty-handed when it comes to a pharmaceutical intervention, a simple solution to Alzheimer's? And part of it is because of marketing. So including that first Alzheimer's patient, Auguste D, who was seen by Alois Alzheimer, his mentor at the time wrote textbooks, and he needed to sell the latest version of his textbook. And the way to do that was to put new information in there. Now, this was a case study of one patient. And you well know, I well know, having gone through the medical system, medical training, you don't put one case study into a textbook. You wait until there's a bunch of cases and we actually understand something about the disease, and then it goes into a textbook. But because he wanted to market this textbook, it ended up in there. When you talk to, fast forward, 100 years, when you talk to doctors who practiced in the 70s and 80s, who are in their 70s and 80s now and retired, they kind of scratch their head and go, what is this Alzheimer's thing? Isn't it called senile dementia? Well, again, when the National Institutes of Aging was looking for funding, they decided to make Alzheimer's this thing that people feared so that they could get more funding for their institute. And then again, because of the pharmaceutical industry and the way that those incentives are set up, we need to be able to diagnose Alzheimer's earlier. So we started focusing on these beta amyloid plaques, and we basically created this paradigm that if we have one single intervention that can be patented and marketed and sold, and in the conventional system where you see patients for 7 minutes, doctors can write out a prescription and patients can go get it from the pharmacy and insurance can pay for it and everybody makes their money back. That paradigm doesn't fit for Alzheimer's, because even when we develop a drug that gets rid of amyloid plaques, you don't get better cognition. We know from the research that came out in 2011 that only 2% of the worldwide population, if you take babies to centenarians, only 2% of the population doesn't have amyloid plaques. And you can get people who are centenarians with plenty of amyloid plaques with perfectly fine cognition. So although there's a correlation between amyloid and Alzheimer's and dementia, they're not directly causal. It's a sign, it's a symptom, it's related, but the causes are upstream. And that's where we have control. And that's where Dr. Bredesen's approach really starts to make sense.
But amyloid is actually a sign of protection because it's like an antibiotic. Rudy Tanzi, I believe is his first name. He showed that amyloid is actually trying to protect the brain and it's trying to protect the body. It's binding metals and binding against toxins in the body.
Yes, exactly. Amyloid is a sign that the brain is trying to protect itself. And so the natural question to ask next is, from what? And so what are those things? We think of the 6 components of brain health: toxins, infections, stressors, structure, nutrient imbalances, and signaling. And when we can put these things into balance, right, the right amounts at the right time, happening in the right place, then we have the homeodynamic balance that supports neurocognitive function at the cellular level, at the neuronal level. But when we start to have imbalances, too many toxins, too much stress, too little cortisol or too little B12, or we have cortisol spiking at night and melatonin spiking in the morning and our diurnal rhythms are off. When we have imbalances, that leads to neurodegeneration.
So tell me about the risk factors. We started talking about it. I think you mentioned hypertension as the first one. We talked about that, and we talked about some medications that could increase dementia or memory loss. Talk about some of the other ones: obesity, type 2 diabetes, weight, smoking, air pollution. Talk about some of those.
Yeah, exactly. So let's go through all of them. There's 12. So it's high blood pressure, smoking, diabetes, obesity, sedentary lifestyle or lack of physical activity, a poor, unhealthy diet high in saturated fats, salt, and sugar, most importantly, excess alcohol consumption, low levels of cognitive engagement, depression, social isolation, traumatic brain injury, hearing loss, air pollution. And then there was one more that they talk extensively about, but they don't list as one of these 12. It's like the bonus 13th, and it's sleep deprivation, but also sleep apnea. It's abnormal sleep that can lead to cognitive decline. I have had patients with severe cognitive impairment with MoCA scores, this Montreal Cognitive Assessment, down in the single digits, indicating severe dementia, who have turned that around and nearly doubled their MoCA scores in the course of 12 months when they got on a CPAP, when they got their undetected, untreated sleep apnea detected and aggressively treated. It changed their lives profoundly.
And there's people that their oxygen levels on an oximeter will drop. Normal would be like 95, 94. It drop in the high 70s, even without having sleep apnea. That is also an issue.
Starving the brain of oxygen at night is essentially mild brain injuries each night.
And with sleep, if you sleep less than 5 hours or more than 10 hours, it also is a risk factor. Is that correct?
Right. We want 7 to 8 hours, 7 to 9 hours of sleep is ideal, with 90 minutes of REM sleep and 60 minutes of deep sleep, so that we can consolidate memories, so that we can take the bite out of the emotional experiences that we've had throughout the day, and also so that the glymphatic system has the opportunity to rinse amyloid from the brain and rinse toxins from the brain.
So when we get back from the break, I want to go through what you started talking about, the different causes of dementia. And then we're going to go through what people could do to reverse it, which is very similar to what the causes are. And, and I'm very interested in the work that you've done. You've done these incredible studies. And Dr. Bredesen, and I believe he's coming up with a 200-person study. Is that correct?
There's about 100 people, I think, who have been recruited, but it's a controlled trial.
Now let's talk about genetics for a second. How is genetics important when it comes to dementia, Alzheimer's? And can you define the different types of dementia? Is it just Alzheimer's? There's different forms of dementia. If you could kind of separate them for us.
Yeah, absolutely. So dementia is the umbrella term, and underneath that, Alzheimer's is the most common form of dementia. And 2/3 of Alzheimer's patients are women. And so when it comes to Alzheimer's, when it comes to the other dementias, things like frontotemporal dementia, vascular dementia and Alzheimer's are very interrelated. And oftentimes you'll see somebody will have Lewy body dementia, but they still have amyloid plaque as well as Lewy bodies. There's a lot of intertwining of these different neurodegenerative diseases, even though the pathophysiological process in the brain can be slightly different. So when it comes to risk factors, we talked about the 12, 13 with the bonus modifiable risk factors identified by the Lancet. Now, when we talk about genetics, this goes into the bucket of unmodifiable risk factors, things that are outside of our control. We can't change our gender. We can't change the year we were born, our age, our chronological age, and we can't change the genetics our parents gave us. So ApoE, APOE is an elephant. ApoE is one of the single nucleotide polymorphisms associated with the development of Alzheimer's. The general population has a 13% risk of developing Alzheimer's. Now, if you have one copy of ApoE4 from mom or dad, so you get a copy from mom, a copy from dad, and the potential copies that you could get is a 2, a 3, or a 4. This gets a little confusing, but the common is to have a 3-3. That's the most common genetics. But if you have one copy of 4, so say a 3-4, a 3 from mom, a 4 from dad, you increase your risk from 13% to 30%. Now, if you have 2 copies, a 4 from mom and a 4 from dad, your risk goes to well over 50%. And there was a recent Nature paper published that suggested that essentially you inevitably get Alzheimer's if you live long enough and you have ApoE4 genetics. Interestingly, if you're from a large family and you have 4 genetics, you are at even higher risk. So if you have siblings, like you have 6 or 8 or 12 siblings, you have even higher risk of developing dementia.
So people that have 4, that's about 7 million people in the United States. How can you find out if you have that? Where can you go and get a genetic test?
Yeah, so you can ask your primary care provider to run ApoE status for you through LabCorp or Quest. You also can get access to this because they're single nucleotide polymorphisms. They're available through many of the genetic tests that you can get online without the support of a provider. And you'll have to kind of dig, but if you've done 23andMe, it's in there.
And if you have one ApoE4, which is 75 million people, you still have about a 30% risk of getting dementia. Is that correct?
That's correct. And just 10 years ago, when I was earlier on in my career, people would say, I don't want to know. That's just going to keep me from sleeping at night. That's just going to increase my stress. And there's nothing I can do about it. And yet now we're in a very, very different place. There is so much that we can do about it if we know that we have 1 or 2 copies of ApoE4. What we can do is we can behave differently than maybe our spouse needs to or our neighbor needs to who doesn't have those copies of the genes. We can go back to these modifiable risk factors and each year or regularly check, are we getting good high quality sleep? Are we making sure that our blood pressure is well managed? Are we making sure that our weight is managed? Are we making sure we're engaging in those meaningful social connections so that we can reduce our risk as much as possible? And if you have 1 copy, you're in the 70% who never end up with dementia. And if you have 2 copies, you at that at the very least, you delay for as long as possible the onset of any cognitive decline.
So what is some, as we talked about earlier, it could take about 20 years before someone develops dementia. But what are some of the early signs that people should look out for and say, this is, or early symptoms that people should look out for and say, wow, this is something I have to be concerned about?
Yeah, so everyone's a little bit different, but common signs are the inability to find words, the loss of language, also losing your train of thought, losing items. So if you notice you're losing your phone, and once or twice isn't a lot, many of us get distracted. But if you notice that you're losing things more often, also the sense of overwhelm. If you can think back to 5 years ago, mom used to throw the Thanksgiving party for 25 people, and now that's way too much for her to take on. That's a sign cognition isn't where it was previously. That execution, that executive function of being able to plan and execute complex tasks, like planning a trip, planning an international trip. If mom used to do that all the time and now that's way too overwhelming for her, that's a sign there's a change in cognition. So there's this like double-edged sword, right? We want to be aware of it, but we don't want to be overly stressed out about it because that can start to become a risk factor. And what we want to do is find that empowering at those early signs. So dementia happens in four stages. There's the pre-symptomatic stage that you were talking about, where the pathophysiological changes are taking place in the brain, sometimes 20 years before that first symptom. And then there's that initial subjective cognitive impairment where the patient notices, or the family members notice, she's not the same. My brain is not working the way it did 5 or 10 years ago. And that is the place to intervene. That is when we have the highest confidence that we can turn things around. And often we can pick up on testing now. We do the p-tau 217, which indicates the integrity of the neuronal structure. And we can get this tested, and that's an early indicator of the neurodegeneration towards Alzheimer's. So we can look at that and use that for directionality as well as the cognitive testing. And we do ASLs, which is a brain MRI imaging that can help us to understand what's going on in the brain. But if we can do that early on, we have the highest confidence of full recovery. Now, the third stage is called mild cognitive impairment. And this is a misnomer. I prefer to call it measurable cognitive impairment because there is nothing mild about this. This is when people are starting to lose the ability to navigate, to plan things, maybe even losing their jobs if they're not retired yet. So things are changing dramatically in terms of what they're able to do, what they're capable of, what they're overwhelmed by. But they're not quite at that dementia, that full-blown dementia stage, which happens as that MoCA score decreases, where you lose your dignity eventually. But in the meantime, you lose the ability to communicate your activities of daily living. You need help dressing, bathing, brushing your teeth, grooming, etc. And so what we want to do is catch this early so that we can intervene. And the earliest sign that you have this elevated risk is that genetic status.
So let's talk about the different types. There's the type 1, the inflammatory type. Tell us about that. Because
Right.
if we understand the types, then we could understand about preventing it.
Yeah, and so Dr. Bredesen has this phenomenal framework that kind of breaks this down. And first thing to mention here is that these are not mutually exclusive. You can have more than one type, and that increases your risk. So what we're trying to do again is check these boxes. And so inflammatory, this might happen because of diet, but we have also the toxicity, but it might happen because of infections. There are lots of things that can lead to inflammation in the brain. It might be, so inflammation, which can be measured by HSCRP, can be measured on neuroimaging. We can get different indicators that there is high levels of inflammation in the system that are going to trigger that amyloid plaque production.
And if you have a big belly because you have metabolic syndrome, that goes to type 1.5, glycotoxic. Could you talk about that for a second?
Right, so glyco is the type of Alzheimer's that is associated with excess sugar. Glycotoxicity means that essentially you've gotten so much sugar in the system that you have become, so it's become like it's crystallizing, or like the way you would caramelize an onion. Basically, the toxicity of sugar is causing an increase in neurodegeneration just because those neurons themselves are caramelizing. This is an irreversible process. Advanced glycation end products are another term for this type of disease, and you would know this well because it affects the eyes, part of the nervous system. Additionally, insulin itself is highly inflammatory. And so when we have insulin resistance, we have high levels of insulin, which does its own set of damage in addition to the sugar.
So what do you think about the new drugs, Ozempic, the GLP-1s, Wegovy, Mounjaro? Is that going to help us? And
So we can have our cake and eat it too. I actually think that it can be a way to reduce inflammation. We mentioned that excess alcohol consumption is a risk factor for developing dementia. And for people who have significant alcohol cravings, history of alcohol consumption, significant food cravings, food addictions, I think that there is definitely a time and place for these medications.
How about cholesterol? How does that work? Is high cholesterol a risk factor?
So it depends on the type, right? I don't think of all cholesterol as bad. Cholesterol is there for a purpose. It's highly expensive for our bodies to make, which is part of why we recycle it and we reabsorb it in the gut. So cholesterol is the backbone of stress hormones, sex hormones. It's crucial to any sort of healing from a surgery or an accident or a cut or a scrape. We need to have cholesterol around. And I've seen people who have cholesterol suppressed to total cholesterol of 100. And this scares me. I think of this person as they have no libido. They're going to be depressed, they're going to be achy, and they're not going to feel very good. Their existence is not going to be very fun. So it's a matter of balancing cholesterol. Do we have enough good cholesterol, or do we have high levels of the most risky cholesterol markers like SD-LDL, small density LDLs, or do we have high levels of homocysteine, which puts us at higher cardiovascular risk? Do we have high levels of Lp(a), which are going to make that cholesterol more sticky and more likely to form plaques?
How about the atrophic type 2?
Yeah, so this is
What do you mean by atrophic?
Atrophic means we don't have enough trophic factors. We don't have enough stimulating production. So Dr. Bredesen talks about the brain as a country, my brainiston. And if you are at war, if the signaling is telling us to get small, to defend, or to attack, we're not getting the signals that we get from all of those trophic hormones that tell us to build, to recover, to regenerate, to connect. So trophic factors include thyroid hormone, vitamin D, which is also a hormone, vitamin K, and then our sex hormones are testosterone, estrogen, progesterone, pregnenolone, DHEA. These signals tell the brain to create new, to build, to regenerate, and repair.
So do you think hormone replacement is good, or do we have to worry about it causing cancer? And that's bioidentical versus horse hormones.
Yeah, so we only use bioidentical. We never use oral estrogen. Estrogen is always topical. And then I think that, of course,
hold that thought, Dr. Sandison. We're coming up to a break. This is so interesting to learn about the hormones. We'll be back after the break with Dr. Heather Sandison. Pick up our book, Reversing Alzheimer's. This is Dr. Kerry Gelb.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
We're back with Dr. Heather Sandison, naturopathic physician. Her book, Reversing Alzheimer's. Her book has made the New York Times best-selling list. And we're going through the causes of dementia or Alzheimer's. And I think we're up to toxic symptoms. So
Type 3, yeah. So toxicity can cause Alzheimer's. Again, what's causing neurodegeneration at the cellular level? So high levels of metals, mercury, arsenic, lead, cadmium, these can lead to neurodegeneration, particularly mercury, which can come from amalgam, so can come from metal fillings in our mouth. Dentists don't do this anymore. So if somebody tells me they've still got amalgams, I know that they're old, and old ones are more likely to crack our teeth, and they're more likely to be creating a vapor, a mercury vapor that we can then inhale and swallow potentially. So we want to get those out and get them replaced. Another potential exposure to mercury is through fish. And we talked about this on the previous show that we did, but we want to focus on the smash fish and avoid the high, the fish at the top of the food chain. Things like ahi, shark, swordfish, these can be very, very high in mercury. And shark, we often don't know that it's shark. It's like the fish sticks that use the bycatch. And so we want to avoid any fish that's not named and focus on wild-caught salmon, mackerel, anchovies, sardine, and herring. Those are the smash fish that we know are going to be high in those omega-3s, good for our brain, and not detrimental or toxic. So that's the heavy metals. Typically, cadmium is going to come from cigarette smoking, but it can also come from the from dirt, basically. It can get into foods that way. And arsenic comes from conventionally fed chicken. Is high, their food is high in arsenic, and it can also come from fires. So there's a few places to some detective work to do in terms of where that's coming from, but we can use binders to help get that out. And then another, so I think of toxins like ice cream. It comes in 3 flavors.
Speaking about arsenic, I interviewed Dr. Joe Pisano. I'm sure you know him.
Yes, he was a teacher of mine.
So yes, he gave a great podcast on environmental toxins for people to go back and listen to that. I keep going. I'm sorry to interrupt you.
He is the expert in toxicity and has some great books about that. He wrote the textbook literally on that. So we have metals, mycotoxins, and chemical toxins. So mycotoxins come from mold, and this is from water but damaged buildings. Things like Stachybotrys, Penicillium, Aspergillus, these create toxins. And this is because if a tree falls in the forest and the microbes are after it, they need to compete against each other for resources and for food. And so one of the ways that they do battle is by creating these toxins. And in our drywall and in the paint, there's a lot of fungicide. When those microbes feel under threat, when the mold feels under threat, it releases more toxin. It also breaks up the building materials, and they themselves can be toxic. So water damaged buildings can be highly toxic and really hard on the nervous system. So we want to identify that and be able to get rid of it, use binders. Again, there are specific binders to get rid of the different mycotoxins that include ochratoxin, trichothecenes, gliotoxin. There's a handful of them, and so it's great to be able to test them. I test them in urine most often, and then we can watch them come down as we treat that. The third category of toxins is...
What are the toxins? Are you a fan of zeolite, clay, doing smoothies, infrared sauna? What are you a fan of to get rid of toxins, or all the above?
All of the above. I was trained by Dr. Neil Nathan, who's another expert in this toxic mold world, and he has a book called Toxic. And there have been studies that show that cholestyramine actually binds ochratoxin preferentially. And so if you have high levels of ochratoxin created by Penicillium or Aspergillus, then the fastest way to get that down is through, I use compounded cholestyramine. Now, if it's gliotoxin, then we're more likely to use, we can use Saccharomyces boulardii, we can use chlorella. I use zeolite. It works with a lot of them. It's not super specific. And then for Zerolone, we'll use more chlorella and N-acetylcysteine. So, and then with mercury, we'll use IMD. Mercury and arsenic, you can use this IMD powder that's been created by Quicksilver. It's a silica product that binds preferentially those metals. But for lead, you want to use something like EDTA. So this is where it comes in really handy to test instead of guessing, because there are binders that are preferential. Now you can go back to the organs of elimination, right?
Should ask for it to see if they have toxins.
I use a couple different tests. So I use Quicksilver for heavy metals, and then I use real-time labs for urinary mycotoxins and environmental pollutants and glyphosate.
Great, thank you. We have a lot to cover, so I'm not going to repeat it, but if you just go back and listen to it and you'll get the information. Anything else on toxins before we go to type 4 vascular?
Well, environmental toxins also include the chemical toxicity, and there is, right, there's 87 million toxins in the environment. We can't avoid them all. I'm exaggerating, that's hyperbole, but there are so many toxins in the environment. They're ubiquitous. We can't avoid them. But what we can do is take control of the things that we know about by eating organic so that we're not exposed to glyphosate. We can measure glyphosate, and when we see that this is up over 1, we want to figure out, where is it coming from? Is it from our diet, or is it from the environment? Are we spraying it in our yard, or is it sprayed on our HOA and the dogs are rolling in it, and then it's coming into our house? Where is it coming from? And then glycine is a great way to eliminate glyphosate. There's also a glyphodetox product that's out there that can help with that, but also parabens, phthalates, petrochemicals. Is it in the water? How are we being exposed? Can we eliminate the exposure? And then can we open our organs of elimination so that we can get rid of it faster? Again, have bowel movement every day. Drink plenty of clean filtered water. Make sure we're getting our liver the nutrients it needs to go through phase 2 detox. Make sure we're using breath work as a practice so that we can eliminate toxins through our breath, and then sweating 3 to 4 times a week. We've been talking about our Minnesota roots. One of my favorite things to do in Minnesota is to get in the sauna with my family. And we see that in the literature, people who regularly sauna, hopefully they're getting that social support while they're in the sauna, but you also get the detox support. So like in Finland and Scandinavian developing countries, we see that that reduces your risk of dementia. And I'm sure part of the mechanism is that we're getting this detox support.
And who makes that glypho detox product?
Isaac Elias's his product is called Glypho Detox, and it is from EcoNugenics.
Thank you for that. And anything else on toxins, or can we move to vascular?
I mean, we could talk about toxins all day long, but we can move on to vascular.
Go back and watch Dr. Perzano's talk that when I interviewed him, because we had 2 hours on toxins. So let's go to vascular.
He is the expert on that. So type 4 is vascular dementia, and this is driven by cardiovascular disease, right? When there is either you're at risk for strokes, for atherosclerotic plaques, for clotting, for basically any impingement in the ability to transfer blood into the capillaries and to get oxygen and nutrients into your brain and then back out. Now, there are also the leakiness in the blood-brain barrier, that inability to have that barrier. So now you're getting more of the toxins and you're being exposed to more of the junk that can get in if you don't have that high integrity barrier. So this is all part of that vascular disease. And the best way to do this is working in combination with your cardiologist, or it's the diet, it's the exercise, it's treating sleep apnea, really important piece of that increases our risk of cardiovascular disease. And then modulating those risk factors when it comes to homocysteine. That's one of the inflammatory markers that can tell us that you're at higher risk for developing vascular disease as well.
Just over what number you're concerned where we start losing gray matter?
Yeah, so if we aim for 7, and it won't get flagged until about 10, but even people who are around 9, I'm aiming to increase methyl donors like methyl B12, B6, methyl B9, or folic acid, and then potentially some of the S-adenosylmethionine, SAMe. That can be another way to help give methyl donors that can help to reduce that number.
And the Hachinsky score, do you recommend doing that?
I don't use that in my clinical practice. Do you?
I don't personally, but I know that I think Dr. Bredesen has mentioned it. So that's not something you use. Okay, well, let's move on from that. Trauma, head trauma, anesthesia. You could lose some memory points there.
Yeah, Dr. Bredesen has a really great point about anesthetics. So when you go under general anesthesia, first, if you can avoid it, that's the best thing to do. But when you go under general anesthesia, there's 2 primary risks. One, the anesthetic itself is toxic and the body has to be able to eliminate that. And of course, it has neurological symptoms. That's the whole point, right? Is to numb the nervous system while you're going under. And then 2, what can happen when you're under general anesthesia is that your blood pressure can drop very, very low. And the anesthesiologist doesn't really worry about this. But if you struggle with cognitive decline, you want to be aware of this and ask your anesthesiologist to maintain it can be low, but not too low. You want to maintain a normal blood pressure during the procedure so that you don't risk reducing the blood flow to the brain while you're under, because that can be very hard to recover from. It's kind of like having sleep apnea.
As we finish up this segment, we got about 2 minutes left. Just a little bit about, I think we talked about it a little bit before, about the different medications that are used to treat Alzheimer's that are traditionally used if you go to a neurologist. It's funny, Dr. Perlmutter calls a neurologist, him being a neurologist, diagnose and adios.
Right, exactly. So unfortunately, the reason is because they don't have a robust tool belt. For a long time, their only tools were Aricept or donepezil, and Namenda or memantine. And these 2 medications, they affect the neurotransmitters. But what we saw in 2019, in December of 2019, I think it was, the Journal of the American Medical Association published a study that showed that people 5 years later, if they were on one or both of those medications, were worse off cognitively than if they never started. So this is part of why neurologists say, I have these medications, they don't work very well. I'll see you in 6 or 12 months and we'll measure the decline. And by the way, I've got to take your driver's license away. It really is diagnose and adios. They don't have much else to offer. Now, more recently, these new medications. They are IV medications. You may have heard of Aduhelm, aducanumab, or donanemab is one of the more recent ones. Leqembi or lecanemab has also been on the market for a little while. These are highly expensive, and you run the risk of brain bleeding and brain swelling. These are monoclonal antibodies, again, delivered by IV. And what they do is they slow the rate of progression. So there's no hope that you're going to get any better. You're just going to draw out this torturous disease, and you're going to have to go get MRIs and imaging to make sure that you don't have brain swelling and bleeding.
So let's talk about treatment. We talked about the cause, we set it up, we're actually going to try to reverse everything we talked about. Let's talk about hormones. We talked a little bit about hormones and how hormones could actually affect memory in a negative way. Talk about that and the difference between bioidentical and horse hormones.
Okay, and I want to put it in the context of these 6 components of brain health. So we have toxicity, which we talked a lot about, and you know how to do that. Basically, with binders, we want to identify what's there and then get rid of it. Toxins, nutrients, stressors, structure, infections, and then signaling. So hormones fall in the signaling camp. This is that atrophic type of Alzheimer's. If we're not getting the signals to our brain that tell our brain to create new neurons, we're not going to. We're basically going to be stagnant or stuck in that defend and attack mode. And so these hormones are crucially important to aging well. And the reason there's controversy around this is because of the Women's Health Initiative study, which came out in the early 2000s. And essentially there was panic that if we were using HRT, we were at high risk of clotting, and so of strokes, heart attacks, and cancer. Now, what we see is when we dig into that more, essentially the elevated risk that was happening for women getting hormone replacement therapy was no higher than the risk that women have on birth control pills. And so how do we mitigate that risk? Because there is real risk associated with having oral estrogen, so basically swallowing estrogen pills and increasing our risk of clotting. Well, we can mitigate that by applying this topically. And then when we looked at some of the literature from Europe, we find there's an epidemiological study out of Finland that covered 500,000 women. It was 497,000 women, I think. And what they saw was a reduction in the risk of dying from breast cancer if you initiated hormone replacement in your 50s, 60s, or 70s. So the risk reduction reduced. So your reduction in risk was not as much if you initiated hormone replacement later on, but you still had a reduction in risk of dying from breast cancer if you started estrogen only or estrogen plus progesterone in your 70s. So when we look at the risk-benefit ratio for someone who's at risk for developing Alzheimer's, maybe because they have genetic risk, they have family history, or they're already starting to notice cognitive decline around menopause, oftentimes we end up deciding that the benefit far outweighs the risk. Now, that's not true for every patient, and this is part of why you want to talk to your doctor, but there is a big conversation happening around how to approach menopause and the risks associated with the sleep deprivation. When our progesterone drops, many women will suffer with sleep deprivation. When you have hot flashes and night sweats, that can lead to sleep deprivation. Mood changes, social isolation, not feeling like yourself, brain fog associated with going through menopause. All of these things are manageable, easily manageable with hormone replacement therapy, and often well worth it.
We talked about diet in part 1. Give me 10 seconds on diet before we go to peptides.
Yeah, so an organic ketogenic diet is what we recommend. Dr. Bredesen and I both agree that getting into ketosis is a brain healing diet because it helps with detoxification, reduces oxidative stress, helps to reduce inflammation, and gets more resource to a brain that's often starved of ATP because they're not efficiently turning glucose into fuel. And so getting into ketosis has this sort of magic benefit that often happens in the course of a week. So that's what we recommend. If you're not quite ready to go there, you can add coconut oil by the tablespoon. Now, not too much too fast because that can lead to disaster pants, but 1 tablespoon of coconut oil a couple times a day can help to get you the medium chain triglycerides that turn into beta hydroxybutyrate, or a ketone that we can burn as fuel. So that's one way to edge in that direction. Also reducing any processed foods, reducing your carbohydrates as much as you can. Now, the recent randomized controlled trial that was done by Dr. Dean Ornish at UCSF did a 5-month intervention with a control arm and an intervention arm that showed that using using a vegan diet as the dietary intervention led to an improvement in cognitive function for people with mild cognitive impairment and early Alzheimer's. So there are different diets that you can use. Essentially, the overarching dietary recommendation is to avoid anything processed. If something in the label is not something that you would have in your pantry at home, then don't eat it. If there's maltodextrin or guar gum or some other weird thing that you can't pronounce, don't eat it.
Let's talk about some things that people don't know a lot about. Peptides. Tell me about CMAX, C-Lank, cerebrolysin. Could that help us?
Yeah, so peptides, what are peptides? Peptides are, I think of them like pearls on a string. So if you think of each amino acids are the products or are the building blocks of protein. And peptides are when you start to string those building blocks together. And then a protein is when you start to take that strand of pearls and you turn it back on itself and it becomes a tertiary structure or a three-dimensional structure. So these peptides are short chains of amino acids, and they, again, are signaling molecules. The OG peptide is insulin. Many people are familiar with somebody who's had insulin-dependent diabetes, and you have to inject it. Part of the reason is because you wouldn't be able to swallow insulin orally, and it would break down in your gut. And so you wouldn't be able to make use of it as insulin. So many of the peptides are injected for that reason. These amino acid structures, they need to stay intact. And so in order to do that, you have to inject them. But two of the ones that we use for cognitive function are C-Lank and C-Max, and both of these can be done intranasally. And what I typically see for patients is that there's this bump in cognition that happens in the first 3 months or so, and then it kind of plateaus. We sort of stop getting the benefit of the C-Lank and C-Max, but both of them help to support neurogenesis. They send the signals to the brain to support neurogenesis and synaptogenesis, the formation of new neurons and new connections between those neurons.
Great. And tell me about contrast, oxygen therapy, and EWAT.
Yeah, okay. So part of what we think happens with the brain is that there's not enough oxygen getting to the cells to maintain positive neuronal function. And so then when we think, okay, how do we get more oxygen there? Exercise is the fastest, quickest, best way to do that. But if I have some sort of constraint and we can't do that, then hyperbaric oxygen therapy is a passive way to basically push more oxygen into the cells. You're under pressure, and there's an Israeli study, and they're doing this in Florida in big hard chambers where you're increasing the pressure and then going back and forth from sea level into essentially these ATMs, this pressure that's in the system. It's like when you're scuba diving. So that's why we use these chambers to help people who have the bends, who have been scuba diving. They can gradually get them back to sea level. But you can use these chambers also to force oxygen into the system. And then when you go back and forth between sea level and these high pressure chambers, you get benefits. You get oxidative, basically there's oxygenation benefits. So that's one way to do it. And those are becoming more and more available. I think right now they're only available at a center in Florida. And then another way to do this is through EWAT, or exercising with oxygen. So instead of passively lying in a hyperbaric chamber, now you're exercising. And when you're exercising, you're moving blood and oxygen around in the body. And so you can use highly concentrated oxygen and be breathing this while you're exercising. And for somebody who's more frail, this is a great way to reintroduce exercise because you don't build up the lactic acid, so you don't end up having the soreness associated with oxygen, and you tend to have more stamina. So you feel like you can go further, you can maybe go faster with whatever you're doing for exercise. Now, if you want to take that to the next level, if you're not in that frailty state, but if you're looking to use that hormetic effect where you stress the system in order to get more benefit and more resilience, which essentially can be a definition of health, right? The more resilience you have to stress, the kind of the healthier you are. Other things that fit in this hormetic category are exercise, right? When you do bicep curls, you're essentially stressing the muscle so that you get more resilience, so that you build the muscle. When you fast, you end up this is another hormetic effect where when you're fasting, you stimulate senolytic atrophy or apoptosis of the senolytic cells. So you're getting rid of those old cells. Now with contrast oxygen therapy, what we're doing is going from high altitude, like Mount Everest, down to concentrated oxygen. And when we go back and forth between that, we get changes in the capillary beds, in the pressure of the capillary beds. We get a buildup of CO2 that actually helps us with oxygen disassociation into the cells. And so we see benefits of the senolytic benefit. We kick out old cells, and then also of this hyperoxygenation. And over time, we see higher mitochondrial density in each cell so that we can actually have the tools and the resource we need to make even more energy and ATP in the brain.
And how about red light therapy?
Yeah, this is a really fun one. Again, this can be used passively. So we use the V-Light, which is a helmet type thing that you can put on your head. It actually even has a nose clip so that you get red light going up through the cribriform plate into the brain. And what we see with red light is that it works on the cyclooxygenase enzyme, and it helps, again, to enhance mitochondrial function so that we can get more ATP. The reason I know this works is because it helps with wrinkles and wound healing on the surface. But we also see that people with more pronounced dementia, with more significant symptoms, in just 20 minutes, they'll be back at baseline and can be out of an anxious state and remembering better.
Now tell us about what supplements you recommend.
So the first supplement I recommend to all of my patients is Qualia Mind. Qualia, Qualia, is a really sophisticated nootropic stack. And so this puts a bunch of the different things that you've seen out there, like Bacopa and Huperzine and CoQ10. All of these things are added together so that you can take them in one formula to enhance cognitive function. I notice when I take it that I'm more articulate, I'm able to focus, I'm more productive, and I actually even sleep better at the end of the day. And many of my patients notice that their cognitive function improves after just a week or so on this product, and even the same day. So
where would you get that?
Yeah, so it's available through qualialife.com or available on Amazon as well, wherever you get supplements.
The name of it?
Qualia, Qualia, Qualia Mind. It does have some coffee bean extract in it and a little bit of caffeine. So if you're sensitive to caffeine, they also have a caffeine-free version.
How about NAD? What do you think?
Love NAD. Some people notice really big benefits. Other people, it's more moderate. We recommend doing NAD. You cannot swallow NAD. It'll break down in the gut. And so you would have to do NMN or nicotinamide riboside, NR. Those are the oral precursors you could take, or you can do injections. So you can do sub-Q injections or IV. Where we see the most benefit is with IV NAD. But supplements, there's several supplements so I have about 5 on my list that I give almost everyone who's struggling with cognitive decline. One is Qualia Mind. 2, fish oils. We use Zymogen's Monopure, but Nordic Naturals is another brand that's easy to get a hold of. And you want to aim for 3 to 4 grams of EPA and DHA. DHA in particular is important to the brain, but both are important for maintaining inflammatory levels and keeping cytokines down and reducing the detrimental effects of chronic inflammation. And so you want to make sure you're getting good levels of omega-3s. That's important for mood, for skin, for brain, for everything. Then number 3 is vitamin D. And as long as you're not on blood thinners, I like combining the vitamin D3 with K2. So talk to your doctor about that if you have any risk of clotting or if you're on blood thinners, if you have AFib, if there's anything coming up or that you think this might be a concern, you can just take D3, but it works nicely for brain and bone health in combination together. Another one I really like is probiotics. I'm a fan of Zymogen products. I've used them for a long time. The Probiomax, the 100 billion, a friend of mine, she did her research as a PhD research. Her dissertation was in how to get probiotics to colonize the gut. And she said, you want a bunch of them. So you don't want 1 million or 1 billion. You want 100 billion. You want a ton of these organisms. And you want to take them with food so that they don't die from the stomach acid in your stomach, because they're meant to colonize in the intestines. Most fermented foods are a great way to increase probiotics in the gut. But most fermented things are food, and that's part of how they work their way through the acid in the stomach. So take a ton of them, take them with food, and then mix them up. So I usually start people with Probiomax because we get really good clinical efficacy, but I also like the seed probiotic. I like pendulum probiotics. I like Garden of Life probiotics. I like the orthomolecular probiotics. There's a bunch of them out there, and I highly recommend rotating them and rotating the fermented foods that you eat as well, because brain health and gut health are intricately connected, and part of that story is the microbiome. The other part of that story is, can we digest? So you might be deciding to eat really phenomenal brain healthy foods, but then as we age, many of us don't make as much hydrochloric acid or pancreatic enzymes. And so adding digestive enzymes with your meals is another way to make sure that you're getting the nutrients that you need for brain healing.
Anything on lutein and zeaxanthin, we use that in the eye care, and there's been some studies that increase blood flow to the brain and can decrease dementia. Is it something that you've thought about at all?
It isn't something that I have used routinely, but since we are talking about it, I'm writing it down and I would like to add it to my list. So thank you for teaching me about how we can promote both eye health and brain health at the same time.
There's a company called Macula Health that makes a really good product for that, for brain health. So take a look at that. One thing about mitochondria, do you recommend any mitochondria supplements?
Yeah, so in the Qualia Mind product, there is a lot of support for that, but also Qualia Life is their other product that specifically helps with mitochondria. And then NAD is phenomenal mitochondrial rebooting.
And how about PS or PC?
So phosphatidylcholine, phosphatidylserine, I always recommend this if somebody has a history of a traumatic brain injury. We'll use pretty high doses. PC, I also use phosphatidylcholine. I'll use if we need detox support, particularly with the bile flow, it can be very helpful. And then also, phosphatidylserine can help to sustain sleep. So we'll use a product called Seriphos, which is 1,000 milligrams of phosphatidylserine before bed. If someone is waking up at night, if they don't have issues getting to sleep, but they have trouble sustaining their sleep, phosphatidylserine can be a game changer in terms of getting that sustained sleep.
And how about the sirtuins? Anything Physin, quercetin, resveratrol?
Yeah, so again, those are in the Qualia Mind stack. We love the sirtuins. Those are really important. Yeah.
And anything that I've left out when it comes to supplements, or anything else that I didn't ask you about that we should ask you about?
Yeah, well, so much of the supplementation, we're using them for a purpose. And so this precision medicine idea. Creatine is one that comes up often. And many people are noticing there's been benefits, mostly people were using it for weightlifting, but recently there's been studies that have come out that show it's helpful for cognitive function. And so that's another one that we'll add. But a lot of what we do is based on the individual. What do they need? And so we'll use binders and liver support if there's lots of toxins. We'll use anti-inflammatories like the pro-resolvin mediators if there's a lot of inflammation. We'll use bug killers if there's imbalances in the gut microbiome, or if there's protozoa, we'll use antiparasitics. It depends on what's going on for that particular person. But oftentimes we'll use these in place of a medication, right? We want to resolve something so that those risk factors, so those causal level factors for dementia resolve completely.
Ashwagandha to help calm the brain?
So these are great. This kind of is in that category of adaptogens is what we call them. And these are things that help to modulate stress. So right, if somebody has high levels of cortisol, if they seem to be affected by high degrees of stress, then rhodiola, ashwagandha, astragalus, there are a whole host of these adaptogenic. Ginseng is also in Qualia and associated with cognitive function, but also is an adaptogen. Yeah, there's many herbs that we can use there.
My last thing, melatonin. People want to know about melatonin, good, bad, or indifferent.
I'm a fan of melatonin. It's it helps to reduce oxidative stress, so it's a great antioxidant. And glutathione is in that category as well. So melatonin and glutathione, great additions if we're worried about oxidative stress, which we can measure. We can see lipid oxidases that can build up. We can also measure to see if there's enough glutathione. We can measure if there's enough melatonin as we're going to sleep as well. But melatonin is anti-cancer. And one of the things that is so crucially important to brain health is getting enough sleep and getting quality sleep. So if you have trouble falling asleep, I think melatonin is a great place to start. For some people, they're groggy in the morning. Not everybody tolerates it. You can use different doses. So I often will start people with 1/2 milligram. Most supplements start at 1 or 3 milligrams. If you're doing an anti-cancer dose, it can get up to 20 milligrams. So there's a wide range of dosing. And so you can play with the dosing if you're having trouble with any fogginess or grogginess in the morning. but also consider things like phosphatidylserine if you're having trouble staying asleep. 5-HTP is another thing that can help us to stay asleep. Melatonin helps us get to sleep. Serotonin helps us stay asleep. So 5-HTP can help with that, as well as mood in the morning. Make sure you're not on an antidepressant that's a serotonin reuptake inhibitor, because you can potentially end up with too much serotonin. But also for sleep support, we can use inositol, we can use magnesium, we can use theanine, taurine. There are lots of other things, lemon balm. I mean, the list goes on and on and on and on. What we can do for magnolia bark, hinokiol is another one. If I sit here long enough, I'm just going to keep coming up with more and more and more things that we can do for sleep, because there's
one more thing, IV nutrition. Are you a fan of that? Do you do that in your office?
We do it in my office, and many people, like I mentioned, as we get older, we don't have enough digestive enzymes, and so we'll become overall nutritionally depleted. And then in addition, if we're fighting infections, if we're fighting off toxins, this is highly nutrient, it's expensive. This requires a ton of extra nutrients. And so for a little while, we'll often replete nutrients with IV nutrients, particularly if there's gut issues and we know that somebody isn't digesting and absorbing well. We need to go around the gut in order to have the nutrients that are necessary to heal and resolve that gut issue.
And if somebody wants to see you as a patient, how can they do that?
Yeah, you can check out solcere.com, Solcere, solcere.com. It's solutions for the cerebrum is how we think about that, or soul, sun, light shining on the brain. Solcere.com, Solcere. And I see patients on Wednesdays and Thursdays.
I want to thank Dr. Heather Sandison for joining me today. She's a wealth of information. She has a great book, Reversing Alzheimer's, on the bestsellers list of the New York Times. Go out and get it. And she's been amazing. Thank you so much for spending time with us.
Dr. Carey, it's been an absolute privilege to be here with you today. Thank you for having me.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.